My name is Sam Whittier, and I am a first-year ophthalmology resident. For me, ophthalmology was sort of a culmination of everything in medicine that I found interesting. The complexity of ophthalmology with really challenging problem solving was always attractive, and its integration to the rest of the body. The first time that I was in an ophthalmology clinic and saw that a systemic disease could be diagnosed through the eye was just kind of mind-opening and broadened the horizon of the possibilities. The fact that it's a surgical specialty is obviously very attractive, or else I wouldn't be choosing it. And having grown up working with my hands, playing the guitar, working on homes with my father growing up, it's something that I always wanted to do. I enjoy fixing things, and the reward that comes through maintaining and restoring vision for anyone, to me, is just, I can't think of something that would be more rewarding in medicine. And of course, the up-and-coming research in ophthalmology is, such a big part of the field. There's so many dedicated to that, and it's just exciting to see the possibilities and what might be discovered throughout my future career. I look forward to learning as much as I can about ocular pathology and about actually managing eye diseases outside of the textbook. Of course, we have 3 months of ophthalmology in our intern year here, but spending more time in the operating room, on the eye simulator, and in the wet lab, and actually bringing some of those skills that you've wanted to refine into actually materializing those, I think is going to be really exciting. It's going to take a lot for me to want to step away from research and kind of the leading edge of discovery altogether. So, there's always that thought of, do I go and practice in some type of community versus stay somewhat academic? And I definitely want to be a part of that new discovery and teaching in some form or another. Where that might be, I stay open-minded. I have a couple areas of specialty that are particularly interesting to me, but again, I've learned that staying open-minded has served me well, and I will continue to do that. And I'm just excited for what might come and where I'm led there. Advice for incoming PGY1s, I would say, wherever you are, to have an open mind and to recognize that, you're shifting from, essentially being that student without a lot of responsibility to now, you're a doctor. And although you have a lot of oversight, it's to be patient with yourself as you learn to take on that new role. But at the same time, really try to be present, because those moments with the patients, they will teach you so much, and you will really learn a lot about yourself as well as medicine in the process. My time in Madison has been interesting because I was fortunate to come here for a research fellowship. And so I had a year here before I started internship, and my family and we just fell in love with the whole surroundings of Madison. It's so green during the spring and summer, and there's just so much to do. I think if you went and walked or biked a new trail, I went to a new park every weekend, you probably couldn't exhaust all of the options here in the course of residency. And of course, the great food and people. It's a fantastic place to be.